50% of the patients presenting to us with heart attacks, they have some positive family history. If father has a heart problem, then the next generation has 25% extra chances of heart attack. If father, mother both have a heart problem, they have 50% increased chances of heart attack. Never shy away from taking a pill which controls the blood pressure if your BP is high.
And that is safe for lifetime.
Absolutely. Silent heart attacks are much more common in women because they miss out on symptoms.
If a person feels they're having chest pain or left arm pain, as you're saying, what should be their first step that they should undertake?
Never ignore a chest discomfort or a left arm discomfort if it is persisting for more than 10-15 minutes. Have a ECG done.
Hello everyone and welcome to the 15th episode of Conversations with Zyla. I'm Khushboo Aggarwal, founder at Zyla Health, and today I have the extreme pleasure to host today Dr. Rajneesh Kapoor. He is the chairman of Interventional Cardiology at Medanta, well known for the best-in-class cardiac treatments. Dr. Kapoor, it's a real pleasure to have you with us today.
My pleasure.
On the occasion of World Heart Day, which is observed in September every year, we are addressing a very, very important topic, also aligned with the WHO theme. Don't skip a beat, preventing heart attack in the young. Dr. Kapoor brings with him 3 decades of experience and is a pioneer in cardiac interventions, complex valvular and coronary procedures. He has performed over lakhs of diagnostics and interventional procedures, helping care reach around the nation. He has been the recipient of prestigious awards such as Punjab Ratan in 2018 and India's Most Promising Cardiologist in 2022, a testament to his lifelong commitment to saving hearts. Dr. Kapoor, we are all big followers of Medanta, and what a pleasure to host the chairman of cardiology from Medanta today. Thank you for joining us.
Thank you. It's my honor to be here.
Thank you, Dr. Kapoor. So, Dr. Kapoor, the topic today is of extreme importance, especially because all of us are quite anxious and reading on various social media channels about someone or the other we know, a dear one passing away suddenly in a young age because of a heart attack. So we would first like to address this very important topic, and I have few questions for you to first address, and then we go to the nitty-gritties and detailing of this. So we'll ask you a few questions as a rapid fire, Dr. Kapoor, and then we take it from there. The first one is, are heart attacks increasing in the 30s and 40s in India? What is the top reason?
I think the major reason why it is increasing in this young segment is a lot of stress with the younger population and the lifestyle changes. So that is that these two things I'll put it as main triggering factors for heart disease and sudden deaths in the young.
Got it. Dr. Kapoor, what is the youngest age at which you have treated someone with a heart attack?
I encountered a patient with a heart attack at 22 years of age.
22.
Yeah.
So there is no young age anymore.
Absolutely. No age bars, no demarcations anymore.
What is the single most common overlooked symptom you see in young heart attack patients?
Still, I would say that many patients, they miss out and ignore their chest discomfort. They feel some chest discomfort, but they attribute that to the acidity or burning because of faulty eating. So that symptom is not to be ignored.
Got it. And what percentage of heart attacks in the young are silent, meaning they didn't even get to know they're having some symptom?
There are many patients like this where they had some symptom, mild symptom, they miss out, and then after 2 months they find out that it was a heart attack. So I would say 30% of the younger patients, they have a silent heart attacks.
Wow, so any doubt, you must actually visit the emergency room.
Absolutely.
Which city has the highest incidence of heart attack in the young?
I think many metros in India, they have a high prevalence of heart attacks, but still I would narrate that Delhi NCR should have maximum heart attacks in the younger population.
I'm just hoping this is a bias given you're located here. And we are reporting from Gurugram right now, but got it, Dr. Kapoor.
No, that bias has some facts behind it because Delhi continues to be the most polluted city still.
Yes, that is correct. How do young patients typically describe their first symptoms of a heart attack?
Mostly, some discomfort in the chest or the left arm.
Okay. What percentage of young patients who suffered a heart attack would have a family history?
This is very important. Now, many patients, I would rate almost 50% of the patients presenting to us with heart attacks, they have some positive family history. The family history is very important because if one member in the family, if father has a heart problem, then the next generation has 25% extra chances of heart attack. If father, mother both have a heart problem, or I am saying paternal tree or the maternal tree, not the father, mother, but if father, mother are okay, but grandfather from the paternal side or grandmother from the maternal side, they have heart issues, they have 50% increased chances of heart attack.
Wow.
So almost 50% of the patients presenting to us with heart attack or heart problems, they have a positive family history of heart problems.
Okay. And Dr. Kapoor, when you say family history, do you mean heart attack in the young, in a family member, or it could be in a 50s or
Now,
60s?
this is even more important, and emphasis should be laid on the fact that what was the age of a father or a mother once they had a heart attack. If they had a heart attack less than 55 years of age, or heart problem, or angioplasty, or bypass, not even heart attack, so then the chances of heart problem in the next generation are even higher. So if the family had a heart issue at a younger age, the chances are even higher. If they had a heart problem more than 60 years of age, still they are prone, so still they are vulnerable, but lesser than the previous subset.
Got it. And Dr. Kapoor, why is it happening in Indians more? There's a lot of news around we are genetically predisposed, we have narrow arteries. How much of this is really true?
This is absolutely true. As Indians, I think it runs in our genes. I still think that 70-80% of the Indian families, some member or the other had some heart problem at some point of time. So it is running in our genes. Genetically, we are heavily vulnerable for this heart problem. So that makes us almost a very high candidates for heart disease. So we have to be cautious from the word go. We can't take it for granted. Okay, fine, we are healthy. I think once any Indian crosses 45 years of age, the vulnerability starts. So if he is not cautious, then he is making himself more at risk for a heart problem.
So very often you said you see patients even under the age of 25, 30 who, walk up to you and you notice that these are heart attack symptoms, right? So what is the first workup? Like if a person feels they're having chest pain or left arm pain, as you're saying, what should be their first step that they should undertake?
Yes, so first thing is that never ignore a chest discomfort or a left arm discomfort if it is persisting for more than 10-15 minutes. Do not attribute it to a acidity or a faulty eating. Have a ECG done. So do not miss out on your first heart problem. That is one. The second part is also equally important, at what age they should start getting screening. So that we believe, if anybody has 3 or 4 big risk factors for heart disease, the positive family history we have talked about. Second, if someone has high sugar levels, which is pre-diabetes or diabetes, high blood pressure, if someone is a smoker, and cholesterol levels are high. So these are the risk factors for heart disease. If there are 1 or 2 risk factors amongst what we have talked about, then the screening should start much early. Then we say after 35 they should be getting a yearly screening test if they are having a risk factor profile. If there are no risk factors, they can this age limit can go up to 40 or 45. Screening should start after that. But that one thing which again emphatically I am trying to say, do not miss out on symptoms which are suspicious of heart disease. Get a ECG done, and there is one very simple test which we call it as a cardiac marker. The cardiac enzymes, that is troponin T or troponin I. This is Tropi test. This is a very simple blood test and doesn't cost much also. So that rules out whether anybody with these symptoms is having an acute heart problem or not. If that is negative, then one can be sure that this is not a heart problem or a heart attack. So then one can just take it more lightly. But these are the very simple things, and people miss out on these simple things to miss out their first heart attack or the diagnosis of heart problem.
Right. So, Dr. Kapoor, what you're saying is that a gastric burn or a left arm pain, chest pain should not be ignored. You should go to the hospital. One is that you go to the hospital. Second, what happens, Dr. Kapoor, sometimes is that you end up in the hospital at 3 a.m., 4 a.m., and there may not be a senior cardiologist available. And they may also not do an ECG immediately. So, it's important that the family is also aware and request for an ECG, correct?
Absolutely, absolutely. Don't wait for a doctor to decide on these facts. This is a very simple thing. Anybody having a discomfort, you ask for a ECG. And even if the hospital is far off, you can go to any clinic nearby, get a ECG done. And these days it's very easy, the social media and WhatsApp, you can message any doctor of which is known to you and send a ECG or get a troponin eye test. These are not big things, and they are readily available almost everywhere now. So I think the need of the hour is to be aware of the fact that, irrespective of your age, you can have a heart problem. Do not keep thinking that you are immune because you are young. So nobody is immune now from a heart problem. Anybody who's having symptoms, please get yourself tested, and a simple ECG and a troponin test can rule it out.
Right. And what is the biggest mistake you have seen, Dr. Kapoor, in, by patients or, even by medical practitioners when we miss out on reading a heart attack that should be avoided?
See, these things still happen. I won't say that they are not happening. I mean, there are still sometimes the diagnosis is missed out, and we have seen in our practice also, patient keeps on complaining of symptoms. They have landed at some hospital in the emergency, and the doctor has done a ECG where first ECG is fine, and somebody is still attributing it to acidity or a burn, and then the patient goes back home, and next morning he again lands up with a massive heart attack. So sometimes the first ECG is normal even with the heart attack, and it takes time for the ECG changes to come in. So normally we say that if symptoms are there which are suspicious, even if the first ECG is normal, wait for some time, get a second ECG after 1 hour, and that second ECG also being normal, then heart attack is ruled out by 99%. And if added troponin T or eye test is done, that is even more specific.
Got it. So basically it's important to completely rule out a heart attack when you even walk up to a hospital with a first and second ECG and a trop-I or trop-T test, only then come back home.
Absolutely, because
Yes.
implications can be huge.
Yes, we've read these news recently on LinkedIn, and you get very worried that
Absolutely.
someone in a hospital and was declared normal, and then they came back home, and at night, they had a heart attack.
See, now that's what we are trying to talk, that implication can be a loss of life. So additional hour or some wisdom into that we get one extra ECG or a troponin test, that may save a life. So I think it is extremely important to keep that in mind, that irrespective of age, we all can be vulnerable. So do not take the symptoms lightly.
Got it. Thank you so much, Dr. Kapoor. I think that was the first and foremost learning we needed from you. Now, just talking a little bit more deeply about the causes. We spoke that South Asians are at predisposed genetic risk of heart attacks. Could you elaborate on this? What is really different in our arteries or in our genetic makeup that makes us predisposed to a heart attack?
Yes, so genetically predisposition means one, it is running in families, that's one. But besides that, we are more predisposed because as Indians or Southeast Asians, our artery calibers are very small, and we are more prone to develop blockages at an earlier age as compared to the Western population. And also the blockages which develop in Indians, they are more diffuse. It's not a single spot blockage. It's a blockage at multiple points. So that we call it as a diffuse coronary artery disease. So small caliber arteries, more diffuse blockages, more lengthy blockages, more calcified blockages. This is what our genetics lead to.
We are born with this.
Yes. So unless it is ruled out that this is fine, in Indian setting, I think it should be worthwhile saying that we all should be suspecting it, that we can have a heart problem.
Got it. And Dr. Kapoor, is it also true that in India we also have more of calcium deposits, not just fat deposits in the arteries?
Absolutely, that's what I pointed. So, calcium depositions in the arteries, small caliber arteries, more tighter blockages, more diffuse blockages. This is the usual findings which we find in our caths or in angiographies, which we do so frequently on our patients. So, this is where the heart disease, the heart blockages are more complex in Indians, and that also gives us a challenge to treat them. Although the expertise levels are also very high in India, I would say, with all the interventional cardiologists, they know how to treat it, but then it gives another layer of some extra challenge.
Got it, got it. And is it true that all of us living above the age of say 20 would have some form of blockage from 0 to X%? Is that true?
Not all, I would say. There are still many people who would have normal coronaries. But I think, yes, as we progress in age, the chances of developing some kind of blockages 20%, 30%, 50%, and then once someone crosses 30, 40, the chances are growing. So, some kind of heart disease, even if it is non-critical, with a plaque formation, the fat deposit is, we call it as a plaque. Plaque formation in the arteries will continue to happen and grow as we grow in age. So, I would say, yes, many individuals, many guys from our population will have this kind of disease where the plaque formation has started. Now, if somebody is not controlling the lifestyle well, these plaque formations will aggravate and
Got it.
slowly go on towards having a heart attack or unstable anginas. So, that is where I am saying that we take it that we are very vulnerable for heart disease, and our lifestyles should always be directed towards that, how to prevent it or how to mitigate the progression of heart disease.
Right. We'll talk all about preventive strategies in a bit, Dr. Kapoor. Just before that, because blockage of artery is a very, very complex topic for people to understand, what percentage of blockage is alarming when you will take action?
See, mostly we say that a blockage more than 80% is alarming. That can lead to more acute heart events, heart attacks, or unstable anginas, which can be catastrophic, which can be life threatening. So, more than 80% is surely to be treated. Now, 50% or lesser, I think we are not worried acutely, but yes, we are worried in the long term.
Got it.
That we should take all the measures that these blockages should not progress. Now, between 60 to 80% is a gray zone. That is where the dilemma comes in the mind of a treating cardiologist and the patient, whether they should get it treated with some procedure or not. So, for that, now the science is well advanced to figure out that which are the blockages of 60 to 80% which are specifically to be treated or to be left for medical therapy.
And are there easy ways of knowing what blockage I have today in my arteries?
Yes. So now anybody doesn't have to go ahead with conventional angiography. There are CT scans available, and having a CT scan now with the advanced CT scans, it just takes 15-20 minutes to get a CT scan of your arteries, and that exactly tells you that how much blockage is there. And I believe now a threshold of getting a CT scan in India should also be lower because we are genetically more predisposed. One should know that if there is a 30-40% plaque formation or a blockage formation in the artery, now I'm sure that guy then becomes more meticulous in terms of lifestyle as compared if he doesn't know.
Got it. And have you seen cases where the blockage was really not there, but still the person had a heart attack?
No, that is a very rare phenomena. I think that is a very rare phenomena. This is called, your term is called MINOCA, the myocardial heart attack with normal coronaries for the layman language, I would say. It happens in 1 or 2% cases where some clot formation happened. There was no blockage, some clot came into the arteries, caused a heart attack and then washed off. By the time we got angiography, the arteries were clean, but heart attack happened. Mostly it is true with smokers. It happens with smokers.
Got it. So if you're not smoking and you get a CT scan done, say above the age of, you mentioned 35?
35.
Every 3 years.
Every 3 years.
Then you're kind of safe, right?
Absolutely.
And you know that if your blockage is less than 60%, your chance of getting a heart attack is then quite low.
Yes.
But you still have certain gastric issue, chest pain, left arm pain. You immediately go to the hospital, stay there for a couple of hours and get at least 2 ECGs done at the interval of 1 hour. So this is
Final.
a sure shot way of sort of preventing a heart attack.
Absolutely.
Got it. Okay. And now going beyond genetics and family history, Dr. Kapoor, you also mentioned lifestyle quite a bit, right? So is there a direct linkage of, say, eating outside food, oily food, refined foods to heart disease?
Yes. So that's what I was pointing it out, that these days the faulty lifestyle is the major trigger for heart attack in the young. So I think we all know that now, having a fried food at home is just a 5-10 minutes away. We can call any Swiggy, Zomato, and they will deliver the food in 10 minutes, whatever food you like or want to order. And mostly the young individual is keen to have all the fried things. I don't think anybody who's giving an order to the Swiggy, Zomato, they are asking for fruits.
Or salads.
No, or salads. Nobody is doing that.
Yes.
99% of the population who's ordering food, they are either calling the French fries, the pizzas, the burgers, or all the creamy stuff.
Right.
So, which is a faulty food. And that food is leading to lots of changes, lots of things in our body where the cholesterols rise, the sugars rise, and that in the long term, I won't say that happens in a day or two, but yes, over years or 2 years or 4 years, things will start building up in your arteries, and that plaques and blockages, they develop and lead on to the heart problems. So yes, this is a major trigger that food habits have to be controlled. We can't keep on doing that and say that, okay, we just ate a faulty food for 2 years, why we are having a heart attack? This is what we are going towards a problem. We are calling a problem while we are doing this kind of lifestyle.
Got it. Got it. So food habits must be watched for, and I think ghar ka khana is the best approach in such a case. And Dr. Kapoor, what about stress or today's hustle culture where you're always running on the go, on the phone, on social media, right? Is that also playing a role?
Yes, this is also extremely important to look at this angle, that stress has played a major role in giving heart attacks to a younger population. I feel the younger guys are much more stressed. They are kind of following a lifestyle where they want to just achieve things with a shortcut. They are very ambitious. They want that things should happen in a year or two. And then the guys who are into corporates, probably their targets are also getting more and more complex and difficult, and that also is adding on to stress. The peer competition is adding on to stress. So I think this stress has to be managed well. I won't say that slow down your life. I'm sure the pace of the life is very fast. Yes, moderating it is extremely important. But even if you want to carry on with this lifestyle, you should know that how to manage your stress well. The first and foremost thing is to manage the stress is that you should be expressive. You should be talking of your problems with your friends and family. You don't keep it inside. Then the stress multiplies. And then this stress leads on to a lot of hormonal changes in the body. The heart rate goes up, the blood pressure goes up, and all these things further are leading to bad heart health and can lead to a lot of heart attacks.
Right.
There is a simple saying, I like this saying, 2 lines, where some poet had a heart attack and he mentioned after that, अगर की होती खुल के दिल की बातें यारों से, अगर की होती खुल के दिल की बातें यारों से, तो शायद आज ज़रूरत ना पड़ती दिल को चिरवाने की औजारों से.
Wow.
So this is something that which is quite realistic in the today's era, that we should be more expressive.
And so heartwarming coming from a cardiologist, Dr. Kapoor. So you're saying spending time with family and friends, venting out your stress, talking more, I think.
Is one way to manage your stress.
That's amazing. Of course, then seeking counseling, etc., if required, but just you're saying talking to friends and family. That's really well said. Thank you, Dr. Kapoor, for that. Now, Dr. Kapoor, there is an elephant in the room that I want to address with respect to causes, which we also see questions coming from the audience. So one we keep getting is on COVID vaccine, and has that suddenly led to this sudden heart attack increase in the young? Now we can also say we are a lot more aware, we're a lot more on social media, so we are reading about those cases more. But I think it is also intersected with that COVID era. So is there a linkage?
Yes, so COVID was a bad phase, and we saw a lot of surge of heart problems after COVID. There is no doubt about it. The heart attacks increased post COVID. We saw lots of young individuals landing with either heart attack or a sudden deaths after COVID. So there is no strong data to say that COVID is a reason for that. But yes, what happened? COVID infection or a COVID vaccine, the antibodies somewhere increased the sensitivity of the heart muscle. So the heart muscle became more prone to have some problems because of this increased inflammatory sensitivity of the heart muscle. So some arrhythmias, rhythm problems happened, some heart attacks increased. So that happened for sure. So there was something happening, but there is no concrete data on that. But then the good point is that now, once we are 3 or 4 years down the line, the antibodies have weaned off. Now there is no speculation that there are increased things happening because of the COVID vaccine or COVID infection which happened at that point of time. Initial 1 or 2 years, we could still sense that more problems are happening with the heart post COVID. But now that phase is out. So we are okay with that.
So now we can stop putting the blame on COVID.
Absolutely.
And focus on our lifestyle and preventive testing, basically.
Yes.
Great. And just covering about risk factors, Dr. Kapoor, a lot of men in India, and starting with early 30s, end up with high cholesterol. So high LDL, high triglycerides, very, very common in reports. Low good cholesterol, low HDL. So what is happening here? And is this really also leading to heart attacks? And what is the best way to manage?
So in India, what happens, the faulty diet starts from the childhood. You go to any school, I don't know if you can clearly think of that, but go to any school's canteen. So what the canteen provides to the school children is a lot of fried stuff again. Samosas and noodles and pakoras and this, that. There is no canteen in the school which I could figure out gives salad or fruits. No way. And another big ritual in India is to keep exchanging the mithai, sweets, for every celebration or anything. So all these things are a bad diet culture. So we are not teaching our younger ones, the school going kids, that how to develop a good diet culture. So then what happens that over the time they are exposed to this culture, and then they are not able to change it. So that leads to more cholesterol, more fats in the body. Many of the school going children are obese now. Obesity is another villain. So these things definitely adds on to more heart events and more heart attacks as they keep growing. So what cholesterol is doing or bad fat is doing, they are accumulating in the arteries and causing a blockage. So now if we slightly tweak it, that we start telling our small kids that this is the way of healthy lifestyle, and I would go a step further, that there should be chapters in their books to say that this is how to prevent a heart disease. I don't know why this is not happened in our educational policy. Adding a simple chapter how to prevent a heart attack or a heart disease from the school going kids.
Or what to do when someone is having a heart attack. Yes.
Both things. That will go a long way in preventing a heart disease. So no doubt that a good diet is must, and we need to create this awareness how to escape a bad diet. That is more important.
Great. Dr. Kapoor, it's amazing to see that a senior cardiologist is more focusing on the lifestyle aspect than just, going on the medical intervention. But even after doing this, or, someone's not able to control their diet for whatever reason, they have high cholesterol. And the doctor is saying you need to go on medicines like statins. So now, should I take a statin? Should I not take it? Should I take it for some time, or should I take it for lifetime? What is the decision there?
So statin is a very good drug to decrease the cholesterol and fats. Now, indication wise, yes, everybody shouldn't take it, but anybody who falls in the indication, which includes that if someone has a familial high cholesterol which is running in the family, someone's LDL cholesterol is very high, or triglycerides are very high, they are the candidates, irrespective of the age, I'm saying. and someone who had some cardiac event at a younger age and cholesterols are still beyond the limits, that guy is also a candidate for statins. Now these guys should have statins without fail. They do not think that after 3 months, if cholesterols got controlled on statins, they should stop it, because statins have many advantageous effects besides the cholesterol lowering. Also they make the arteries more healthy. So then the statins should continue on a long term basis with these indications. If someone has a normal cholesterol, no heart event, no family history, then I think it's not advisable to start statins in that case. But given these indications, the guy should have statins.
Got it. And does diabetes or insulin resistance also play a role? Does that also cause heart attacks?
Yes. So diabetes is a very big risk factor for heart problems. And diabetes is basically what? Insulin resistance. So insulin is a hormone which decreases the sugar levels in our body. Now once it stops acting, which we call it as insulin resistance, that leads to a lot of disease in the body. So this is a very big triggering and a predisposing factor for heart disease. So checking your sugar levels at frequent intervals is must. Everybody should have it. It's a very simple thing. And I would say one thing, that even if your sugar levels are not in the diabetes range but in a pre-diabetes range, so fasting sugar between 100 and 126 is a pre-diabetes range. More than 126 is a diabetic range. So even if it is 110, one should start changing the lifestyle and curtailing all the sweet things so that the sugar levels come below 100. We want sugar levels should be below 100. That is where we call it as healthy. So if you have these risk factors, you are more prone to have heart disease. Beware, this is a time to regulate now.
Got it. And Dr. Kapoor, you mentioned obesity as a risk factor and you said it's starting from childhood now. How do we relate obesity and heart attacks?
It has a direct correlation. Obesity means more fat. Obesity means more cholesterol usually. And a obese guy is more prone to have lot many diseases with the growing time. And so obesity has to be controlled. Obesity has to be controlled. Now only good thing which is happening now is there is first time in the history we have a drug which is meant for obesity. It is here, it is FDA approved, and we are giving it to our obese patients. Now this drug was initially started as an anti-diabetic drug.
Yes.
And now it is approved as an anti-obesity injection. This is in the form of injection, and but very convenient, once a week initially and then once in few months. So that leads to weight loss. But that doesn't mean that we start taking injection, the weight loss happens, and we are only depending on this injection and not on the lifestyle. So
Correct.
all the things have to go hand in hand. So I give a small example. Yesterday only I had a patient who's 150 kg. This guy is a young guy, 30-year-old, or I think 25-year-old, but weight is 150 kg. So we have started him on this injection, but I was very emphatic in telling this guy that you have to have exercise, you have to cut down your food. This injection will help you in for your weight to come down initially, but then you have to maintain that advantage.
Got it. So nothing happens as a shortcut in life. And Dr. Kapoor, what about high BP, right? And this is, I think, a very underdiagnosed condition in our country, given people don't have a BP monitor at home, they don't visit a doctor for years. So is high BP also related to heart attacks?
So high BP is again a very important and very frequent risk factor for heart disease. If the BP is high, heart has to work more, and that puts a strain on the heart. So high BP, we call it as a silent killer. I mean, nobody is experiencing any symptoms. There may not be any symptoms of high BP, but then BP is high. If it's constantly high, then you can imagine over years how much extra work heart is doing against the high BP. So that puts a strain on the heart. So high BP again is a menace and it has to be controlled. But the journey starts that everyone should get their BP checked frequently. This is the problem. So nobody is getting their BP checked. And how should one know that the BP is high. So if good screening is being done with the BP monitoring, which is a very easy thing, then one knows that what blood pressure one has, and if the BP is high, start taking initially the lifestyle measures, which include a salt restriction and a spicy food restriction. If that controls the BP, well and good. If not, then one has to start the pill. Never shy away from taking a pill which controls the blood pressure if your BP is high.
And that is safe for lifetime.
Absolutely. So BP has to be within limits. Normally we say 130 and 80. It has to be less than 130 and 80. 140 and 85 is kind of high normal, but still okay.
Right.
But beyond 140 and 85, irrespective of the age, is high BP.
Got it. So you're saying if someone has high BP, they should immediately go on a medicine and not keep BP high. Otherwise, it's a serious
Otherwise, in
risk
the
factor.
long term, he's getting precarious for the heart.
Right. And Dr. Kapoor, you covered smoking a few times, that if you're smoking, then this, is definitely a big risk factor. So how does that impact the heart health?
Smoking is a very big villain for heart disease. Now, what smoking is doing that with the aerosols it is creating, the harmful droplets it's creating, which has lot of poisonous gases and chemicals which go into our breath and then ultimately into our blood.
Right.
That causes the increased chances of clotting in the blood. So that increased chances of clotting again lead to heart events or heart attacks. So no second thought in anybody's mind that smoking has to be stopped. Smoking cannot be good in any manner. It causes lots of diseases. Heart attack, heart disease is one. It can cause to lots of cancers. It can cause to peptic ulcers. Many diseases you name, and smoking causes it. So smoking can't be justified in any manner. It has to be stopped.
And even like occasional, once a month, once a week.
Even passive smoking.
Wow.
I would say even passive smoking has to be totally stopped. You have to quit the company who's smoking. Even if you are not smoking but continuously sitting in a company who's smoking multiple cigarettes.
Your friends are smoking.
Yeah. So then you are still predisposed.
And how about vaping and hookahs?
Vaping and hookahs are again the same level of violence. No justification. Vaping is banned in India. Hookah, there are many villagers who come to us, हम तो hookah पीते हैं, थोड़ा सा उससे क्या होता है? But they don't understand that they are making themselves highly predisposed and vulnerable for many problems because of that.
Talking about heart attacks in women, Dr. Kapoor, and two ages, right? One is a young woman has PCOD. Is she more predisposed to heart attacks?
So it has been a myth for many years that young women are immune or partially immune to heart attacks or heart disease. This is not true now. So previously what was happening was that women were mostly homebound. They were not working. So that thing has changed. Now that work culture and moving out adds on to some stress. Rather more stress as compared to a male guy, because women now has to take care of two things. A work level and a home front.
Right.
So ultimately they are kitchen makers. They have to take care of kids and then the kitchen, everything. So that adds on to the strain on the woman. So that has also, this lifestyle has also made them more predisposed for heart problems, more stress, more heart problems. So I think, and one more thing. Now because of this myth, many women, they tend to ignore their symptoms more discreetly, Even if they are having chest pain, chest discomfort, they say that because of women, we are immune, we can't have a heart problem. So they keep facing that issue and do not report to a doctor or to a hospital. And there they miss out on heart attacks. You asked a silent heart attack. Now silent heart attacks are much more common in women because they miss out on symptoms.
Okay.
So I think by this platform, if we give this message to all girls and women, that again, if they have symptoms, do not miss out. Do not think that they are immune. So this is one part of this. But yes, post-menopausal, the risk is almost equivalent. Pre-menopausal, the risk I can say is slightly lesser, but in today's era, there is no much difference between a male and a female.
Given the lifestyle and the
Yes,
stress.
yes.
And after menopause, Dr. Kapoor, what is the recommendation for women to prevent heart attacks?
So the same things which we have talked about, they have to take care of all the lifestyle measures. And if they have symptoms or if they have some kind of blockage developing in the arteries, they have to be on aspirin and statins. They have to control their blood pressure. They have to control their sugars and have a good lifestyle where they are walking more. Another thing with women which we find in our practice, they are mostly busy with a kitchen and the home course,
Right.
home tasks, where they keep saying that we don't find time for walks and all. I think that needs to be changed. They should have some time for half an hour for walking or some
they
exercise.
think the household chores are enough exercise.
Absolutely.
That should not be the case.
Absolutely.
Got it. Okay, so Dr. Kapoor, now, thank you so much for covering the causes and risk factors so well. You spoke about preventive measures such as different tests, right? One is ECG, which you do if you are having active symptoms. Then you spoke about a CT scan, which is absolutely safe every 3 years, especially after the age of 35. Now, a lot of people are also doing echo, TMT. What is the indication for those?
Yes, so what happens, getting a CT scan in everybody is not, I would say, cost effective. So the best early first screening test can be a stress echo, TMT and echo combined.
Right.
So it's cheaper, it's easier. In CT scan, we are also giving a dye. So CT scan should be meant for patients or individuals where the risk factors are high, where they have some suspicious symptoms. So that I would say our threshold should be lower in getting a CT scan in those patients. But other patients who are absolutely no symptoms and no family history, no genetical positive history in their family tree, they can have this stress echo as a first screening test.
Right. And what does a stress echo tell us vis-a-vis a CT scan?
So stress echo is telling us the functionality of the heart at resting compared to the exercise level.
Right.
So resting, if the stress echo is fine and it remains fine on exercise, that means the stress echo is negative. The chances of blockage are very minimal. If there are changes which happen while the patient is doing a TMT, if there are changes happening in the ECG or on the echo on exercise level as compared to rest level, then the suspicion of blockage is very high. Then one has to undergo an angiography.
Okay, so an angiography is then to determine the blockages.
Absolutely.
You don't do a CT scan after that.
Then CT scan is not recommended because we have done some screening test which is giving us a suspicion towards a blockage. Angiography should be the next test.
So angiography, then there is a little bit I think it's invasive to some extent.
It's not invasive. It's again a small prick or an injection. That's the only point which is required in angiography. It's a simple 10 to 15 minute test. It doesn't take much. Yes, some blood tests are to be done prior to angiography. Kidney function should be normal. And then if that is the case, angiography is a very simple test and it gives us a clear picture inside.
And if there are blockages, then I think at the same time the stent can be placed.
If blockages are more than 80 or 90%,
Got it.
One can get this stenting or a procedure to clear that blockage. If the blockages are borderline, we do have now many gadgets with us to confirm that whether this blockage is detrimental for the heart or not. If it is detrimental and reducing the blood flow, then again it requires a treatment. Less than 50%, it doesn't require a treatment, but some medications to slow the progress of this blockage.
Got it. And this angiography is a day procedure. It doesn't need a hospitalization.
No, it requires admission, but it's a day procedure, morning admission, evening discharge.
Got it. Okay. Now, Dr. Kapoor, shifting gears and talking about exercise itself, right? Now, there's been a lot of news that someone was exercising in the gym, they suddenly collapsed and it was declared as a cardiac arrest. Someone was running a marathon or someone was dancing on the stage and there's a video which goes viral. So, is exercise safe for the heart? How much exercise is safe for the heart? How do I determine my safety exercise level?
This is important. These news are coming rampantly these days that someone in the gym had a sudden cardiac arrest. There are multiple important personalities also who faced that.
Right.
Raju Shrivastava was actually gymming and then he had a major heart attack and we couldn't.
KK, a singer,
KK
collapsed.
was performing on a stage. I think what is happening is we need to understand one thing, that these days either gym or any other performance which artist is doing or someone is doing, they are pushing themselves beyond a limit,
Right.
which was not the case prior. So now the gym going guys, there are trainers there, and they want to have their muscles within a span of 3 months. So they are trying to push their limits beyond the point, and then so it's kind of competitive also. They are seeing other persons who are working in gym have robust muscles, so they want to also achieve that within a short span. So if you push yourself beyond a limit, then your body is not tuned for that. One has to be careful in doing that. So I would say a moderation is the key. The main statement is that moderation is the key. Do not try to push yourself. Do not try to make a body whom you are thinking that you become a Hrithik Roshan in 6 months. That is not possible. These things come over years and years and with well-trained trainers. So moderation exercise is good. A brisk walk, running, jogging is the best form of exercise. We are not restricting you to go to a gym, but then beware that you should know your limits. And one more thing which is happening these days is that before going to gym, I believe and I would surely say to everybody, get yourself screened from any heart issue, which requires a simple echo test. Now there are some diseases in the heart which lead to more thickening of the walls of walls of the heart, and that thickening leads to more acute heart events and even sudden cardiac deaths.
Right.
So there is no screening happening, and if someone has these substrates in the heart and pushing beyond the limits, then the events would happen more.
Right. And Dr. Kapoor, some people report high pulse rate when they're exercising. So how do you monitor that? What is the alarming pulse rate when you must stop?
Yes. So our basal heart rate or the pulse rate is a balance of two systems in our body. One is a sympathetic system and is a parasympathetic system. I know this is more technical, but simple to say, one is inhibiting the heart rate, one is propagating the heart rate.
Right.
So that balance decides that what heart rate should are we having at a basal level,
Right.
70 or 80, and some persons they have a basal heart rate of 110. So 110 heart rate at every point of time is not good. So similarly, if on exercise, we know it's going to accelerate, but acceleration up till 130 is good. Acceleration beyond 160 is not good. So yes, one should keep that in mind. So again, I am saying that do not try to overdo it. Do not try to lift a weight which is beyond your capacity.
Or suddenly do a marathon.
Yes. So it has to be an endurance training which you should do and constantly keep on doing over months before you start planning that.
So this 160 pulse rate at a general rule, as a general rule is
not good.
Is important to follow. That should be the cutoff.
Yes.
Got it. Okay. So thank you so much for that, Dr. Kapoor. While exercise is important, moderation is key there. So it's a little complex, I think, for people who then become over health conscious. Now, just talking about diet, because you touched upon those aspects, and I think you are a big follower, I can sense from your conversation. There's a lot of confusion, Dr. Kapoor, around, the oils that people use in cooking at home. Saturated, unsaturated, kachi ghani. Is this heart healthy oil packaging safe? So what is safe oil for cooking?
Yes, so this is again very important, and usually it is very clearly advised that refined oils are the best oils in terms of heart health, because there is some filtration done, and in that filtration what happens, they filter out some of the bad fatty acids. So only the better fatty acids or the healthy fatty acids remain, and that is the refined oil. The refining has been done. But then also there are few important tips for all the homemakers, that one, they should keep changing the refined oil every 6 months. because certain refined oils are enriched in certain fatty acids, and other refined oils from other companies, they are rich in some other fatty acids, and our body requires the blend of these fatty acids. So one tip is this, that keep changing. So there are many fatty acids, many oils. Olive oil is good, mustard oil is good. Some commercial names I shouldn't take, but there are other fatty oils which are available in the market which are good. Rice bran oil, Saffola Gold, all are good oils, but they should keep changing that at frequent intervals. This is one. Second ritual which is very common in Indian kitchens is deep frying. So deep frying should be avoided. Shallow fry, and these days air fry concept is also coming up, which is more healthy. So what happens in a deep fry, that whenever we are doing that in kitchens, the oil is also exposed to a moisture. So that leads to more trans fatty acids in the food. So these trans fatty acids are also have a huge tendency to build up in the coronaries. They start forming the blockage. So deep frying concept to be avoided. Shallow fry or air fry is better, and always keep your oil in a well lit area. Do not keep in a dark area, and it should be totally airtight. That lid should be airtight. Moisture should not be going inside the oil. It shouldn't be exposed to that. So these are some of the tips to use the oil to keep your heart healthy.
But then these ads that we see that this oil is heart healthy, there is no such concept of oil being heart healthy, correct?
So it is refined oil, basically.
Yes. Okay. And what about use of salt in Indian diets, Dr. Kapoor, and how should that be controlled?
Yes, so salt is also important in terms of blood pressure. So high salt means more blood pressure, and more blood pressure over the long term can be detrimental for your heart health. So salt has to be well managed, I would say. Very simple tip which I would give here is that whatever salt is added to your vegetables or the normal daily cooking, keep it moderate, do not have it in excess, and no extra salt on top of that. So that
no
means
achars and
no
chutneys.
achars, no chutneys, no papads, and no add-on salt on the salad or on the fruits. Try avoiding that.
This is a lot of self-control, Dr. Kapoor. No outside food, no salt on the top.
No, it's not like that. So I would tell you, we are not propagating this that one cannot have any puri or any pakoda. I think it should be limited. So once a month, I think treat this as a cheat day for your food.
Right.
But one can have it.
Got it.
But try having it home cooked. Do not have it from outside vendors. But occasionally, if one is too keen to have such kind of food, make it once or twice a month, not beyond that.
Got it. And are there any supplements, vitamins which are known to be good for the heart which you recommend to your patients?
Yeah, vitamins are good, and minerals are good, but then it is also said that if we are taking a good balanced diet, which we have talked in elaboration here, I think then one doesn't require the supplements. But yes, today is a time once our vitamin D levels of everybody are low. So vitamin D supplementation one should have if the vitamin D levels are low. And calcium also is good, because over the years, our calcium levels, they also deplete, and our bones become much softer and precarious. So from that level, vitamin D and calcium, and then there are multivitamins available, but that depends that how healthy we are eating. If we are eating healthy, we don't require the supplements. But yes, if there are issues, then we require supplements.
Got it. Great. So Dr. Kapoor, that was extremely informative. I want to end with one last question, which is, what are the top 3 habits you want people to build and take away from this podcast so that, they protect their heart?
Yes, so I think this is a podcast emphasizing about the prevention of heart disease. And in the prevention, top 3 things I would emphasize is daily walks or exercise up to the level which you want. But do not sit idle, do not keep resorting to your bed. So move out, brisk walk, jogging, swimming, anything you want, anything you like, do it at least 5-6 days in a week. That's number 1. Number 2 is diet. So some changes or tweaking in diet is required with everyone. So less of fried stuff, less of creamy stuff, that is a must, and have a good healthy diet which includes more servings of fruits, salads, and more vegetables. And the third thing is manage your stress well. So I think these three things can go a long way in keeping your heart healthy and giving you a good healthy life.
Thank you so much, Dr. Kapoor. It was such a pleasure hosting you today. Thank you for joining
Thank you.
us. To a
Thank you.
lovely audience, thank you for being with us. I hope you learnt as much as I did with Dr. Rajneesh Kapoor, Chairman at Medanta. We'll catch you on the 16th episode of Conversations with Zyla very soon. Till then, good night, Shabakher.